Good afternoon, I'm Sophia. I'm from National Chang University in Taiwan. Today is my pleasure to present here. Now I'm going to talk about my topic, which is called Making Open Question Work towards Patient-Centered Communication. So according to my topic, I will mainly talk about the use of open questions in doctor-patient communication with a particular focus in Taiwanese medical encounters. In medical encounters, communication difficulty can prevent doctors from gaining full insights into patients' problems, and thus affect the doctor to make appropriate diagnosis or treatment plans. The first one is called doctor-patient non-concordance. That means doctor and patient do not have agreements on the patient's reasons. And the second is called hidden agendas. They might occur when patient has something that is quite hard to tell, especially when they face someone they are not familiar with, just like their first visit with their physicians. So to avoid these communicative dilemmas, open questions are used as one of the solutions in solicits patients' problems. Here I'm going to introduce the terms patient's problems. Here patient's problem could be biophysical problems or psychosocial problems. First of all, biophysical problems refers to biophysical abnormal situation which patients have experienced or were found to have in a previous diagnosis, or even might not be aware of by themselves. And the second is called psychosocial problems. They refer to lifestyle and significant social events which result in one's sickness, such as drinking, smoking, or even social isolation. And here, psychosocial problem can also refer to the factors or concerns which result in patients' healthy-seeking behavior. According to Tsai, the scope of openness in doctor's question use, so here, that could be closed or could be open, can be located in the continuance between the two polarities of indefinite and definite. In the following, I demonstrate for questions they are different in their scope of openings based on the meanings of the whole sentence, especially some keyword use. For example, in question 1, what problems do you have? Here the meanings of problems can cover any kind of patient's problems, so that could be biophysical or it could be psychosocial problems. And in the following, actually 2A and 2B are similar in their degree, but just used for different purposes. For example, in 2A, what symptoms do you have? The meaning of symptoms can cover any kind of patient's biophysical problems, such as having a cold, having a runny nose. But in 2B, what is your concerns? Here, concerns more psychosocial orientated, and it could cover any kind of patient's psychosocial problems or concerns. And in question 3, how is your headache? Here, headache is more specific and definite patient symptoms. So according to the meanings of the sentence and the keyword, we can know that they could be open, just like the question 1 to 2B, or closed question, just like in question 3. So the ideas of open conveys two senses. The first feature is called indefinite or non-directive, and the second feature is called revealing or ventilating, such as question 2B. It is designed to reveal the patient's pressures. Based on linguistic analysis, Tsai clarifies semantics and syntactic components of open questions in medical interviews, and thus divide them into 3 types. The examples provided below are from Solomon means, but it might have a language gap because of translation. The first type is called psychosocial open questions. A psychosocial open question is designed to encourage patients to reveal their concerns or to ventilate their pressures. So based on its design, its semantics components will contain one of the following. The first one is negative psychosocial status. For example, did you find yourself emotionally distressed recently? Or non-neutral evaluation on patients' psychosocial status. For example, no children are staying with you to keep you company. This is usually done with a caring tone from the physicians. And the second type is called general open questions. It is designed to cover all possible patients' problems without mentioning a specific one. For example, what problems do you have? Why are you here today? And the third type is called biophysical open questions. It is designed to cover patients' all possible biophysical status without mentioning a specific biophysical one. For example, what physical problems do you have? Do you have any other symptoms? So based on their design, we can know that their semantics component would be indefinite or non-directive because they are not limit the patient's responses to be a specific one. And there are 6 syntactic formats of open question. The first type is called WH format. For example, why are you here today? And the second type is called yes-no format. Actually, it's also function like closed questions in linguistics, but actually it's pragmatically open. For example, do you have any questions or concern? When a physician initiates such kind of questions, the patient might not just simply answer yes or no. And the third type is called tell me format. It looks like a statement, but actually it's function like a questions. For example, tell me your problems. And the fourth type is called indefinite enumeration format. Do you have any hypertension, diabetes, or anything like that? And the final two will be any other formats. For example, have any others? And the final will be and formats, like and. Here, and is function like a continuum to encourage your patient to talk about their problems more. And there is one research questions in Taiwan based on 3 types open questions. How are they applied by doctors to solicit patients' problem in the healthy information seeking stage? And my data was collected from 6 encounters of elder patients in first visits, including 4 females and 2 males, and their average age is 72.8. So, since their average age is quite old, all patients were accompanied by 1 or 2 companions, such as daughters, daughter-in-law, or son-in-law. And 5 doctors participants in these 6 cases. Actually, one of the doctors was responsible for more than 1 cases, but here it's just a coincidence since I received the case randomly. And here, the 5 doctors were all males. Here is a map of Taiwan. Actually, my data was collected from the family medicine department of a teaching hospital in the southern Taiwan. And the language used is solemn means. It's both used by the physician and the patient and even patient's companions. And the 6 videotapes data encounters were transcribed for discourse analysis with the permission of all participants in the videos. Here, I'm going to introduce a procedures in the medical interview. Actually, it's from the opening to closing. But here, I'm going to introduce 2 important stages. The first one is called healthy information seeking stage. It's from the complaint to pedigrees. And the second stage is called healthy information giving stage. But to facilitate my discussion and analysis, I will mainly collect the open question from the so-called healthy information seeking stage. Since in this stage, the doctors will commonly use questions to solicit their patients' problems. So in the research framework, I will categorize doctors' initiate open question into 3 types. and they are general open questions, biophysical open question, or psychosocial open questions, and would like to see how do open question work in Taiwanese medical encounters. So in the following, I select 3 clips from the 6 video tapes to see how open questions really work in Taiwanese medical encounter. In the first clip, in the line 1, the physician asks, 人敢有啥物无爽快无? That means what is so discomfort. Here, based on the meaning of this keyword, we can know that's a biophysical open questions. In the line 4 and line 6, the patient responds, it is like a headache and my feet shake and hands lock stressed. So there are 2 patients' problems. And the line 7, the physician asks another questions again, that is, 敢有其他的无? That means what other symptoms do you have? So based on the meaning of symptoms, we can know that's a biophysical open questions. And the second clip, in the line 1, the physician asks, 即马人安怎? What problems do you have? So based on the meaning of the problems, we know that's a general open questions. And since in this case the patient had problem in hearing, so in the line 3, the physician asks the question again. That is, 即马人有啥物艰苦无? How are you suffering? So based on the meaning of suffering, we know that's the biophysical open questions. In the line 4 and the line 6, there are 2 patient responses. In the third clip, in the line 1, the physician asks, 今仔日來有啥物問題? What problems bring you here today? So based on the meanings of problem, we can know that's the general open questions. And here in line 2 and line 6, that is, recently I feel dizzy and the blood pressure is very high. They are patient's problems in this case. So here my research question is in Taiwan based on type 3 types open questions. How are they applied by doctors to solicit patients properly in the healthy information seeking stage? So in the following, table 1 demonstrates the frequency of 3 types open questions in the 6 encounters. And the 2 prevalent open questions that are used in Taiwanese medical encounter would be the general and biophysical open questions. And table 1 also reveals the biophysical open questions are the most prevalent, but psychosocial open questions are the most disprevalent. The most prevalent, that is biophysical open question, and disprevalent, psychosocial open questions, in the healthy information seeking stage imply the ideas of healthy tends to be dominated biophysically. However, if patients have more than one problems or concerns, the physician might encounter one of the following difficulties. The first one is called comprehensive information. That means doctors might face difficulty in collecting a full perspective of patients' problems and also influence them to make appropriate diagnosis or treatment plan. And this suggests that the use of general and psychosocial open questions is helpful for doctors to collect a full perspective of patients' problems and to avoid the communication difficulty of doctors-patient non-concordance and hidden agendas. And the second problem would be in their agreement. So if patients feel unsatisfied, they might miss some important information since they still have unsolved problems. So that will cause ineffectiveness in medical encounters. In Taiwan, biophysical open questions are the most prevalent strategy for doctors in healthy information seeking stage to collect their patients' problems. Advise that the general and psychosocial open question can facilitate a patient speaking openly. And finally, The author would like to thank Cai Meihui, Cao Fengfu, and Lu Fenghua who allowed me access to their audio tapes data from their research projects. And that's all my presentation. Thanks for your attention and time.